Hello, my name is Sharon Nutter and I am the Antenatal and Induction of Labour Ward Manager. The aim of this video is to provide information for those of you who are choosing whether to have induction of labour at Mid Yorkshire Teaching NHS Trust. There are many reasons why induction of labour may be recommended, including the health of mum and of baby. If you choose to have an induction, there may be some associated complications or risks, and we want to ensure that you're fully aware of these to help you in your decision making. Your doctor or midwife will therefore discuss your options with you to help you to make an informed decision. Some women who choose to have induction of labour may be at increased chance of a forceps or ventouse delivery or caesarean section. All the risks will be discussed with you during your appointment. The Induction of Labour suite is based on Gate 18, our antenatal and postnatal ward on Level C at Pinderfields Hospital. Our dedicated Induction of Labour team will call you on the day of your induction. On admission to the induction bay, your midwife will show you to the side room to start the process. A check of your baby's heart rate will be done to ensure all is well with your baby. Your midwife will discuss the process of induction with you to ensure you understand. Should you choose to have your labour induced, we will explain why, giving you the pros and cons. We will talk to you about your alternative options and I'll allow you time to discuss this with your birth partner. As in the case with anything to do with your health or the health of your baby, any decision will be made in partnership with you and your named healthcare professional. If we have offered you induction of labour but you have decided that you would like to wait a little longer for your labour to start spontaneously, we will support you with that decision. We will work with you and create an individualised plan to suit your wishes, personal circumstances and the reasons we have recommended induction. We may ask you to attend for regular monitoring at one of our antenatal day units to ensure you and your baby remain well. Your midwife may also refer you to one of our obstetricians to have a further discussion about your options, which may include a planned caesarean section, and to work out what is right for you.
Depending on gestation prior to your induction, and if labour hasn't started by itself, your community midwife or obstetrician can offer you something that we call a membrane sweep. A membrane sweep is a more natural way to encourage labour to begin and can help reduce the need for induction of labour. If your waters break before your planned induction date, there are two options available: immediate transfer to labour ward, or to wait 24 hours to allow your body to labour spontaneously. Please contact triage if you have concerns that your waters have broken on the number provided. If you are waiting for your waters to be artificially broken, we can offer you a membrane sweep every 24 hours. If you would like more information on this, please speak to your community midwife or access the Induction of Labour leaflet on your Badgernet app.
If you decide to go ahead with induction, there are two different methods that we can offer you to start your labour. The method you choose will depend on your preferences, what's happening in your pregnancy, how many weeks you are, and the reason for induction. The first part of the induction process is helping your cervix to thin out and start to open. We assess this by carrying out a vaginal examination. The methods used to start this process fall into two categories: hormonal method and non-hormonal. Our non-hormonal method of induction is the cervical ripening balloon. This is how most inductions are started here at Mid Yorkshire, and it's the only method used for outpatient induction of labour at present. This is because non-hormonal methods of induction of labour have the least chance of overstimulating the uterus and causing too many contractions.
Here is the balloon catheter with two balloons at the end. The balloons are made out of silicone and will sit on either side of the cervical opening. Each balloon has a maximum inflation volume of 80 mils. Your midwife will insert the balloon by vaginal examination or by using a speculum. One balloon will be inserted inside the cervix and inflated with 40 ml of sterile saline, salt water, and the other balloon will rest on the outer part of the cervix. Your midwife will inflate each balloon to the 80 ml using sterile saline. The balloons rub against and stretch the neck of the cervix, producing a natural hormone called prostaglandin. Prostaglandin causes the cervix to become shorter and to soften. This prepares your cervix for labour and allows your midwife or doctor to break your waters. Inserting the balloon can feel a little uncomfortable. However, your midwife will explain and support you whilst inserting the balloon. Following insertion, you may experience some period-type cramping and backache. This is perfectly normal. This can be managed well by a warm bath and/or simple analgesia. If you find it a little too uncomfortable, your induction midwife will be there to support you. The balloon stays in place for a period of 12 hours and will need removing if your waters break. If your cervix has opened enough for the balloon to pass through, it may fall out on its own. After 12 hours, your midwife will deflate the balloon and remove the catheter. A vaginal examination is then performed to see if your cervix is prepared for your waters to be broken. Approximately 97% of women who choose the balloon method will be suitable for their waters breaking on the removal of the balloon. If your cervix is not dilated enough for the balloon to be inserted, or if the balloon does not soften the cervix enough for your waters to be broken, a plan to continue the induction process using an alternative method will be discussed with you, if appropriate. In some cases, a caesarean section may be necessary. A doctor will discuss your options with you and your birth partner. Balloon inductions can be offered as outpatient or inpatient appointments. The process for both starts in the hospital, and if you are an outpatient induction, then you will go home after the balloon is inserted and return in 12 hours. If you are booked for an inpatient induction, you will be moved from a side room to a 4-bedded bay with other ladies who are also having an induction of labour. Your options would depend on your reason for induction, as you may require close monitoring in hospital throughout the process. You can discuss this with your midwife, doctor and birth partner, and a decision can be made together.
Our two hormone methods are called Prostin and Propes. Both methods contain prostaglandins which, as we mentioned earlier, help to start off your contractions and help your cervix to become thin, soft and stretchy. They work in similar ways, but both are slightly different. Propes is a pessary, which looks like a tiny tampon. It is placed deep inside the vagina, behind the cervix, and stays inside for 24 hours. It slowly releases prostaglandins over that 24-hour period. Prostin is a gel which comes with an applicator tube to help to position the gel in the same place as the Propes. It comes in a much lower dose than the Propes, but releases the hormones much quicker. A Prostin stays in place for 6 hours, and you can have up to 3 doses if required. This method of induction will be discussed with you at the time of induction booking and would depend on your reason for induction and how many weeks pregnant you are at the time of your induction. Both these methods would require you to stay in hospital in order for your midwife to closely monitor you and your baby throughout the induction process, as these methods can cause overstimulation of the uterus. During your induction of labour, you may experience some mild contractions and back pain. In order to manage this, your midwife will go through your pain relief options with you. The aim of all these methods is to thin, soften and open your cervix enough so that we can comfortably break your waters, which is the second part of the induction process. You may hear midwives refer to this as artificial rupture of membranes, or ARM. This procedure takes place on labour ward in your own private room, as well as your full labour cares until your baby is born. There may be a delay in admission or transfer to labour ward from a few hours to a few days during busy periods. When your waters break, this can often make the contractions that you may already be having much more effective. The waters around your baby's head are now gone, and the head will apply direct pressure onto the cervix, helping your cervix to dilate a bit quicker. Waters breaking can also help to release hormones which can start your contractions, if they haven't started already. Once your cervix is open enough, a midwife or doctor will use an amniotic to break your waters. This will be no more uncomfortable than a normal vaginal examination.
Once your waters have been broken, we would encourage you to stay upright and as active as much as possible to help encourage these contractions to continue or to start. You will be given the choice to give your body the best chance to get into labour by itself, but this would depend on individual circumstances and indication for induction. Please discuss your options with your midwife or doctor. If you are not in established labour, we will offer you the hormone drip or syntocinon infusion. Syntocinon is the name for a synthetic form of oxytocin which you will produce naturally in labour to help your contractions. When labour is induced, often your uterus needs a little bit more stimulation to help increase the length, strength and frequency of your contractions. Your midwife will increase or decrease the dose until we find the right dose for you. If you reach this part of induction process and you are happy to have the oxytocin infusion, we recommend listening into your baby continuously with one of our CTG monitors. Women often find their contractions while on the infusion drip are more intense than before. In this case, please let your midwife know so they can discuss your pain relief options with you. If you are booked for an outpatient induction whilst at home, you can do things as you would normally. For example, showering, bathing or walking. If you have any of the following: bleeding, contractions, concerns about baby's movements, you feel unwell, the waters around baby break, the balloon falls out, then you are advised to call the Induction of Labour team. A member of the team will speak to you and advise you on what you need to do. Following your return to the induction suite, your balloon will be removed. If we are then able to break your waters, labour ward will be informed. If they are not able to continue your induction, you will be offered the choice to stay in hospital or return home and wait for labour ward to contact you. If you choose to return home, the induction team will call you to offer you daily monitoring and ensure your well-being until we are in a position to invite you to labour ward.
If you are booked for an inpatient induction, the induction team will make contact with you on the day of your planned induction. We want you to feel as comfortable as possible during your stay with us, and we would encourage you to come prepared for anything you will need for you and your baby after birth. Larger items such as car seats can remain at home until you are ready to be discharged home with your baby. Because the induction of labour process can take some time and delays can occur, extending your stay with us, it is a good idea to bring in items to keep you occupied. For instance, a book, magazines, crosswords or an electronic tablet. You can also bring snacks and drinks and ready prepared food, including takeaways. Unfortunately, we do not have the facilities to reheat patient food in the hospital. We also offer an opportunity to carry out some creative wellbeing journaling whilst in our Induction of Labour suite. We have resources and guides to introduce different creative styles and techniques to help you get started. Choose from styles including poetry and reflective writing, to drawing and painting, to help you process your pregnancy and induction journey so far, whilst boosting your well-being. We do encourage you to mobilise as much as possible and you can leave the ward, but we do ask you not to leave the hospital grounds unless you have discussed and had this agreed by one of the team. We have birthing balls available for your use whilst in the induction bay. To help personalise the process, we encourage you to bring items from home to help you relax and encourage natural oxytocin production. Harvesting colostrum also helps produce oxytocin, and colostrum kits are available on the induction bay, and we are happy to support you with this. A specialised breastfeeding team are also available for additional support. If you have harvested any colostrum at home and you wish to bring that in with you, then please do. Just let us know when you arrive so we can store it in our colostrum freezer. Our hospital offers free Wi-Fi. To connect, please select NHS Wi-Fi and enter an email address. No password is required. Visiting parking permits for the maternity and labour ward will be issued for 24 hours upon completion of an approval form at the full daily rate. This will allow partners to come and go multiple times within the 24-hour period. Please see your midwife on admission for further details.
Delays in the induction process are actively managed by our patient flow coordinators to ensure they are minimised and to enhance patient experience. It is important to consider paternity or parental leave when coming for your induction, as it may be several days before your baby is born. We're always looking at ways to improve the services we offer, and we would really appreciate your feedback about your experience. Family and friends test cards are accessible on the induction bay and ward for you to complete during your stay. Should you wish to speak to a manager or matron, please ask a member of the induction team. For further information, please refer to our Induction of Labour leaflet on Badgernet and our website. You can speak with your community midwife or obstetrician if you would like more information about the induction process or anything else you've seen in this video today. If you have any further questions, please contact our induction team, and we look forward to welcoming you to Mid Yorkshire Teaching NHS Trust.